The purpose of this presentation is to describe the changes to PPE practice that have been implemented within the BC Emergency Health Service. First and foremost, the purpose of these changes is to ensure that BCEHS is able to care for staff and keep staff safe, to care for patients and keep patients safe, and to ensure that BCEHS is able to continue to deliver services to the people of British Columbia. We understand that as part of responding to an emerging situation, the COVID-19 pandemic's created a number of concerns for individuals, and these concerns are entirely legitimate. It's raised questions around people's personal safety, and it's raised questions around the impact that our work has on our families and friends. We also understand that with a rapidly developing situation and a rapidly changing situation, there is a significant amount of information being shared around the system. And at times, some of that information can change and develop very fast. We've also seen changes to our normal practice, and we understand that some of those changes to practice may have with them moral and ethical implications for our frontline staff. What's most important, though, is that paramedic safety is our first priority when redesigning procedures around the use of PPE. What's really important to remember, though, is that paramedics across our system have the tools available to them to protect yourself and to protect your patients. We, amongst our paramedic workforce, have a significant knowledge of infection prevention and control procedures, have available to us a variety of PPE to help us cope with a variety of risks in a variety of circumstances. We also have a detailed knowledge of hand hygiene and other basic best practice that helps us keep ourselves safe and helps keep our patients safe. As knowledge of COVID-19 develops, our knowledge of transmission and our knowledge of the individual features of this illness also improves. And with that will be our ability to help provide detailed information to staff and detailed information for our organization to better care for patients. The background to these changes was a letter issued on the March 25th, 2020 by Dr. Barney Henry, our Provincial Health Officer, where we were asked to take steps to conserve available stocks of PPE and make most efficient and effective use of our stocks of PPE. And this was a result of global pressure on a global supply chain. These changes are consistent with challenges and changes facing healthcare workers all around the world. So in terms of what's changed with our personal protective equipment use, we're moving to a place where we're trying to encourage staff to extend the use of our personal protective equipment where possible, and where safe and suitable to reuse some of that equipment. What's not changed has been the knowledge and skills that you, our paramedic workforce, your partner, and the organization have to protect ourselves from a variety of infection prevention and control issues. We have the tools to be successful, and we have resources available to us that help us manage the risk of presented by COVID-19. It's important to highlight that the N95 respirator manufacturer has issued no minimum or maximum use time, and instead has issued recommendations regarding the conditions in which PPE should be exchanged. So the summary of changes for our use of personal protective equipment fall into three main categories. We're encouraging staff or moving to a place where staff will wear personal protective equipment at all patient contacts. And those that basic level of personal protective equipment for all patient contacts will be an N95 respirator, gloves, and a face shield. We're also advocating the extended wear and potential reuse of N95 respirators where appropriate. As I said before, the reuse of face shields. Within this presentation, you'll see a number of useful tools available. The tools focus on understanding the use of personal protective equipment from an operational perspective. These flowcharts and these tools help staff understand the conditions and considerations where they should utilize different levels of personal protective equipment and different steps that staff can take to keep themselves safe. As you look down the left-hand column of this graph, this flowchart, you'll see the various stages of a patient contact. And to the right of each of those steps, you'll notice a number of steps to take for the individual, either a driver or an attendant. It's worth familiarizing yourself with these steps and understanding the opportunities that exist in all calls to identify the appropriate level of PPE required and to identify steps that will help keep staff safe and keep paramedics safe and keep patients safe. So as I said before, for all paramedics attending all calls, we will be utilizing as a minimum gloves, an N95 mask, and a face shield. In addition to that, for all suspected influenza-like illness calls, we'll be utilizing all of the above: gloves, N95 respirator, and a face shield, as well as further barrier protection in the form of a gown. The focus of N95 use is around extending the wear of our respirator personal protective equipment and reusing and cleaning our face shields in between patient contact incidents. In follow-up to feedback around the implementation of these processes, we've included some indications of the utilization of this PPE in conjunction with other personal protective equipment, and in this case, a helmet in particular. So speaking specifically to face shields, a full face shield will protect the user from droplets from blood or body fluid sprays and splashes. If these droplets originate from a patient's cough or sneeze or spit, the level of personal protective equipment we are advocating for will provide an effective barrier. COVID-19 is naturally transmitted by droplets. And as you can see from these very striking images, droplet protection afforded by an N95 and glasses alone do offer some degree of barrier from droplet production. But when compared to the level of protection available using a face shield, the difference is tremendous. An N95 respirator and the face shield provide a very effective combination of barriers for droplet productions in regards to COVID-19. The droplets don't land on the respirator if stopped by the face shield, and prevent a large number of airborne particulates landing on the respirator surface. These particulates are caught in the filtering facepiece of the respirator, and by means of an electrostatic charge on the surface of that mask, aren't able to escape where they do make contact. You'll see during the course of this presentation a number of steps outlining the the application, use, removal, cleaning, and storage of various personal protective equipment, and in this case, a face shield. You'll notice throughout the presentation the emphasis on basic infection prevention and control measures, particularly hand hygiene. It can't be stressed enough the importance of hand hygiene in preventing cross-contamination and preventing cross-infection of a number of contaminants, including COVID-19. Good hand hygiene and discipline around touching one's face and ensuring minimal contact with your personal protective equipment is the best means of keeping yourself safe and keeping your patient safe. When combined with effective barrier control, it makes a very safe system of work for paramedics. You'll notice from the steps outlined for the doffing, cleaning and storage of face shields and other equipment that these steps are outlined in bullet points and described with great clarity with, again, a special emphasis on reduced contact and hand hygiene. Looking at the flowchart on this slide, you'll notice a set of steps and a series of decision points around the doffing, cleaning, and storage of used face shields. In the case of face shields, of primary importance is to inspect that face shield for tears, rips, or obvious soiling with blood or body fluids. If there is obvious contamination or the face shield is damaged or unserviceable, it should be discarded, followed by fastidious hand hygiene. If not, the individual should undertake the steps outlined down the right-hand column, paying particular attention to ensuring that the face shield has sufficient time to dry, and again, with a particular focus on hand hygiene. When re-donning that face shield, the steps outlined describe a safe method for the reapplication of that equipment by the individual, having been stored in the paper bags supplied. Again, the focus is around reducing contact and the performance of hand hygiene. Particular details are outlined on this slide, describing the various considerations and the various steps that operators should take when considering the reuse of face shields. In terms of N95 practice, the key message is focusing around the extended wear over the reuse of an N95 respirator. In practice, what that means is wherever possible, and particularly in higher call volume areas, the emphasis should be on continuing to wear the equipment for as long as possible and only removing where absolutely necessary. By extending the wear, we ensure less physical contact with the respirator, less risk of cross-contamination, and a better likelihood of maintaining the integrity of the N95 seal to the user's face. Extended wear, or extended use of the respirator, refers to the practice of wearing the same N95 for repeated close contact encounters with several patients without removing the respirator between those patient contacts during one shift. It's important to point out that the manufacturer of our N95s does not provide a specific time frame for usage and instead advocates for specific conditions in which they would advise changing that respirator, particularly when breathing becomes difficult or the mask is contaminated with blood or body fluids. Extended wear of an N95 mask is safe. An N95 respirator can continue to be used for subsequent calls as long as it is not contaminated by droplets. It's safe after an ILI call, as the airborne particulates will remain in the filtering face space due to that charge. The reuse of an N95 refers to the practice of using the same N95 respirator for repeated close contact encounters with several patients, but removing it or doffing it between calls, or when you require to eat or drink. We've issued particular instructions regarding the need to store these N95s in a particular way, and provided very clear instructions on how to safely reapply or don the mask prior to the next encounter with a patient. In particular, this slide speaks to the reuse of an N95 mask following the transport of care for a suspected or confirmed ILI or COVID-19 patient. While we would advocate for the continued or extended use of an N95 mask wherever possible, it's also recognized that where a paramedic has cared for a patient with an ILI or COVID-19 and does require to remove that mask, either because of an extended time between patient contacts or the need to eat or drink, that after the contact with that ILI or COVID-19 patient, the mask should not be re-donned and should not be reused. This flowchart describes in detail a set of circumstances and a set of decisions for wearers of N95 masks to decide when and where it is appropriate to reuse that mask. Moving from left to right, you'll notice the particular attention and focus paid to the importance of hand hygiene and the particular decision points and questions that the operator should ask oneself when determining whether it is suitable to store and retain an N95 mask between patient contacts or to dispose of the N95 as per the standard operating procedures. Particularly important questions are in regards to whether the N95 is soiled or wet, or whether you need to eat or drink. If the answer to both of those questions is no, we would advocate the operator, that the paramedic continues to wear that mask without touching the respirator. If the answer is yes, then the paramedic should follow the subsequent flow to determine the most appropriate steps for that circumstance. Again, we'd like to emphasize that the focus is on extending the use of an N95 mask and only re-donning following storage where it's safe and appropriate to do so. We'll see in the subsequent slides that a series of very specific steps are described to support paramedics in removing, storing, and reapplying personal protective equipment, and in this case, particularly the N95 mask, in a safe and effective way. The pertinent points in this slide are to reduce the risk of cross-contamination and to reduce the very small risk of exposure to mucous membranes, and is consistent with best practice for removing respiratory protection in any circumstance, particularly around closing the eyes, removing downwards with an exhalation, followed by visual inspection, and again, emphasizing the importance of hand hygiene. When storing our used N95 masks, we would advocate that paramedics do not store around their neck or on top of their heads, and that they collapse the mask for storage by pulling on the side tabs and insert that mask into a clean paper bag labeled with the user's name, followed by careful attention to hand. When moving to reapply the mask, we advocate again for the use of hand hygiene and for the paramedic to undertake the set of steps described, paying particular attention to ensuring the serviceability of that mask, and in particular, to ensure that the elastic head and neck bands will maintain the tight seal to the user's face, and that the metal nose band is serviceable to maintain a tight nose seal. If there is evidence of blood or body fluid contamination, or the elastic band or metal nose band are not serviceable, or the mask is deformed to such an extent it will not adhere to a paramedic's face, then the N95 should be discarded, perform hand hygiene, and a new N95 mask. If the N95 is fit for reapplication, the paramedic should place the mask on the outside surface down on a clean surface. We would recommend a disposable pillowcase or another clean working area. They should then open the mask by pulling it apart at the nose and chin area, as described in picture B. The paramedic can then grasp the mask by the outer corner and lift off the surface. Again, on application, perform your negative and positive pressure seal checks and ensure that the N95 makes an effective seal against the wearer's face. Of course, then performing fastidious hand hygiene. For the 1860 format of mask, again, focus on effective hand hygiene, removing the respirator from the paper bag, inspecting for blood or body fluid contamination, ensuring that the elastic head and neck bands will form an effective seal, and inspecting the metal nose band to ensure that it will provide a proper seal. Much like the other mask type, we advocate that the wearer close eyes, holds their breath, places the used N95 over their nose and chin, performing negative and positive pressure checks and ensuring that a proper seal is made. If a proper seal can't be made, the respirator should not be reused. And then, of course, after application, the wearer should practice hand hygiene. You'll notice on this slide a summary of our contact and droplet precautions. And it's worth taking a moment to familiarize yourself with the specific details contained on this slide. In support of these changes, we have ensured the inclusion of a number of considerations and some frequently asked questions. In addition, we've provided a number of resources to seek further information around the extended use and the potential reuse of personal protective equipment. Your first point of contact, in most cases, will be your supervisor, off-car unit chief, or your DOSH rep. If not available, consult either with your management teams or other sources of advice outlined in this slide. If you wish to familiarize yourself with the specific policy that underpins this practice, these BCEHS references are available for any member of staff who wishes to This slide describes the external references to BCEHS and the underpinning academic basis for this practice.